A general practitioner, often called a GP, is a doctor who provides primary care for patients of all ages. They handle a wide range of health issues, from routine checkups to chronic disease management. GPS are often the first point of contact in the healthcare system and play a key role in preventing illness and coordinating care with specialists when needed. Pediatrician. A pediatrician is a doctor who specializes in the care of infants, children, and adolescents. They monitor growth and development, provide vaccinations, and treat illnesses common in childhood. Pediatricians also offer guidance to parents on nutrition, behavior, and general well-being, making their work crucial for long-term child health. Cardiologist. A cardiologist focuses on the heart and circulatory system. They diagnose and treat conditions such as heart attacks, high blood pressure, and arrhythmias. Cardiologists often perform tests like ECGs and echocardiograms, and their interventions can range from medication management to coordinating heart surgeries with specialized surgeons. Dermatologist. A dermatologist specializes in skin, hair, and nail conditions. They treat everything from acne and eczema to skin cancer. Dermatologists also perform procedures like mole removal and cosmetic treatments. Because skin is the body's largest organ, dermatologists play a vital role in both health and appearance. Neurologist. A neurologist treats disorders of the nervous system, including the brain, spinal cord, and nerves. Conditions like epilepsy, stroke, and multiple sclerosis fall under their care. Neurologists use imaging, clinical tests, and careful observation to diagnose and manage these complex conditions that affect movement, sensation, and cognition. Orthopedic surgeon. An orthopedic surgeon focuses on bones, joints, ligaments, and muscles. They treat injuries like fractures, torn ligaments, and chronic conditions such as arthritis. Orthopedic surgeons combine surgical and non-surgical approaches to restore mobility and reduce pain, often working closely with physiotherapists during recovery. Obstetrician. An obstetrician specializes in pregnancy, childbirth, and the postpartum period. They monitor the health of both mother and baby, manage labor, and handle complications that may arise. Obstetricians work closely with midwives and provide guidance on prenatal care, nutrition, and family planning. Gynecologist. A gynecologist focuses on the female reproductive system, treating conditions such as menstrual disorders, infections, and fertility issues. They also perform screenings like Pap smears and provide counseling on contraception. Many doctors practice as both obstetricians and gynecologists, offering comprehensive care for women's health. Psychiatrist. A psychiatrist is a medical doctor who specializes in mental health. They diagnose and treat conditions like depression, anxiety, and schizophrenia, using a combination of therapy and medication. Psychiatrists often collaborate with psychologists, social workers, and other healthcare providers to support patients' emotional and cognitive well-being. Emergency medicine doctor. An emergency medicine doctor works in hospital emergency departments, providing immediate care for acute illnesses and injuries. They manage everything from minor cuts to life-threatening conditions like heart attacks and severe trauma. Their work requires quick decision-making, broad medical knowledge, and the ability to stabilize patients before specialist care. Ophthalmologist. An ophthalmologist is a doctor who specializes in eye care, including vision correction, eye disease treatment, and surgery. They manage conditions like glaucoma, cataracts, and retinal disorders. Ophthalmologists combine medical treatment with surgical skills, ensuring patients maintain healthy vision throughout life. Endocrinologist. An endocrinologist treats hormone-related disorders such as diabetes, thyroid problems, and adrenal gland issues. They focus on balancing hormones and managing metabolic conditions through medication, lifestyle advice, and monitoring. Their work is important for maintaining energy, growth, and overall body function. Gastroenterologist. A gastroenterologist specializes in the digestive system, treating problems with the stomach, intestines, liver, and pancreas. Conditions like acid reflux, ulcers, and inflammatory bowel disease fall under their care. They use procedures like endoscopy and colonoscopy to diagnose and sometimes treat these issues directly. Oncologist. An oncologist treats cancer patients, guiding them through diagnosis, treatment, and follow-up care. They manage chemotherapy, coordinate with surgeons and radiologists, and support patients emotionally throughout their journey. Oncologists are central to improving survival rates and quality of life for people with cancer. Radiologist. A radiologist interprets medical images such as X-rays, CT scans, and MRIs to diagnose diseases. While they rarely see patients directly, their work is critical in guiding treatment decisions for conditions ranging from broken bones to cancer. Radiologists combine technology and medical knowledge to detect problems early and accurately. Anesthesiologist. An anesthesiologist provides pain relief and monitors patients during surgery. They administer anesthesia, adjust dosages, and ensure vital signs remain stable throughout procedures. Their role is essential for patient safety, allowing surgeries to be performed comfortably and effectively. Pulmonologist. A pulmonologist treats lung and respiratory conditions such as asthma, COPD, and pneumonia. They perform breathing tests, prescribe treatments, and manage long-term lung health. Pulmonologists are especially important in caring for patients with chronic respiratory issues or infections affecting the lungs. Nephrologist. A nephrologist focuses on kidney health, managing conditions like chronic kidney disease, kidney stones, and hypertension-related complications. They provide treatments ranging from medications to dialysis and work to prevent progression to kidney failure. Their role is vital for maintaining overall fluid and electrolyte balance in the body. Infectious disease specialist. An infectious disease specialist treats patients with complex or unusual infections, including those caused by bacteria, viruses, and fungi. They guide the use of antibiotics, antivirals, and other therapies while monitoring for resistance. These doctors play a critical role in preventing outbreaks and managing emerging diseases. Geriatrician. A geriatrician specializes in the healthcare of older adults, addressing multiple chronic conditions, mobility issues, and cognitive decline. They coordinate care, manage medications, and help maintain independence and quality of life for aging patients. Their work emphasizes a holistic approach to the unique challenges of aging. Palliative care doctor. A palliative care doctor provides relief from pain and symptoms for patients with serious or terminal illnesses. They focus on comfort, emotional support, and quality of life, often working alongside other specialists. Their role ensures patients and families receive compassionate care throughout challenging times.